Okay, we are a little bit behind time, and knowing Dr. Matthews' presentations on the other two, this is going to be jam-packed, full of information. Claudine will remind you again, I'm sure, but if anyone on the call or joining later on catch-up has a pen and paper to hand, feel free to take notes. There will be lots of little nuggets of knowledge from Claudine's expertise. I will leave you in her very capable hands.
Thank you. Well, thank you, and apologies for this interruption. I was looking forward to this evening's session. So as you would have known, if you were following me from the beginning, this is session 3. And once again, just to acknowledge the Red Cell Network and also the Thalassemia UK Society for putting this on. I will move on to the next slide then, please. So just to give you a presentation overview, because we've started late, things will shift a little bit, but this is just an overview of the timings that I'm going to be trying to work to. I will speed it up a little bit so that we can finish as close to the time as possible. If you do overrun, please bear with us. So again, as usual, 3 parts to my presentations. And as Stuart said, there is usually a lot of information. So I'll try and work my way through them as speedily as I possibly can. But the part 1 is usually a recap of session 2. So just to help people who may have missed session 1 and 2 come up to speed, and also just a refresher for those people that have been on those sessions as well. Part 2 will focus on the topic for this evening, which is bone health and immunity. And then we will end off with part 3, as I normally do, with some lifestyle and empowerment tips. The next slide, please. I'd like to start off with a bit of background for those people who haven't been to the talks before. You may not know, where I come from and how I fit into sickle cell and thalassemia. But I was born in Cape Town, South Africa, many moons ago now, and lived during the apartheid regime, so experienced my own sort of racism and marginalization, and definitely gave me a heart for the lesser sort of known and acknowledged health conditions such as sickle cell and thalassemia. I qualified as a dietitian in South Africa before moving to the UK in 2000. I was introduced to sickle cell and thalassemia in 2011, so a couple of years ago now. And in 2012, worked as a social liaison officer supporting both sickle cell and thalassemia patients in that role. But it's only in 2014 that I became aware of nutrition in sickle cell and thalassemia. I had heard of nutrition in thalassemia, but I never heard of nutrition in sickle cell disease, which is why my research has been focused solely on sickle cell and not thal. But I'm grateful for the opportunity to be able to serve you in this way through these education sessions. So I started a doctorate in sickle cell and nutrition in sickle cell in 2016, which I've literally just finished December of 2023. And
Stuart, have we lost Claudine?
Yes, it seems that way. Claudine, if you're still able to hear us, your microphone's dropped out completely. If you maybe want to mute yourself, then unmute. Hopefully that works.
It's not our day today.
No, I think we've lost her completely now. She's just dropped out of the call. Again, apologies, folks. IT is not playing today. We can only really do what we can do while we're having these issues. I've put in the chat for now. If anyone's got questions that they've come armed with, Claudine will mention this. but if the questions you have can go in the chat, we will put them to Claudine off the back of this session, and she'll dedicate some time in session 4 to answer them. Session 4, just as a reminder, is on, I think, May 1st, if that's a Wednesday.
Yeah, I think it is May 1st. Right. Do you want to try to call her, Stuart?
Yeah, I'm on that just now. Just bear with me 1 sec.
I wonder, in the meantime, while she's we're waiting on her to come in so that we don't waste everybody's time. For those of you who've been in the meetings beforehand, I could stop sharing for now, and we could just see each other. When she comes back, we will stop, if that's okay. How have you found it so far? How was the last session? We need you to not be quiet now. Neelam? Sure. I think everybody
Hi, I think it's been really useful, but it's
can recording. So I think you should just go back through this bit, Claudine, and then we could we'll be able to cut the video, like start the video from here, if that's okay.
That's great. Well, yeah, so coming back to just giving you a little bit of background to who I am, so you know sort of how I am connected to thalassemia and sickle cell. So I was born in Cape Town, South Africa, and experienced my own racism and marginalization living under the apartheid regime at that time. And that was sort of why, for now, I have a heart to work with the marginalized groups such as sickle cell and thalassemia. I qualified as a dietitian in South Africa and then moved to the UK in 2000. I was introduced to sickle cell and thalassemia in 2011, and in 2012 worked as a social liaison officer, supporting both sickle cell and thalassemia patients with their social care needs. But it's only in 2014 that I became aware of nutrition in sickle cell and thalassemia. I had heard of nutrition in the context of thal before, but never about nutrition in the context of sickle cell. So therefore, my doctoral research was focused solely on sickle cell and not thalassemia. But I'm grateful to have the opportunity to be able to share this with you. So my doctorate started in 2016, and yeah, had lots of challenges, both health and studies related to my studies during the nearly 8 years of doing that, but thankfully completed my doctorate in December of 2023. The next slide, please. So again, just an overview for those people who haven't joined previously. This is the third session, so focusing on bone health, osteoporosis specifically, and immunity. Session 4 will be on the 1st of May, and hopefully all will go well. And that will focus on major organs, the gastrointestinal tract, specifically looking at things like gallstones, kidney stones, and liver disease, etc. The next slide, please. So as I mentioned before, the part 1 of the talk, there's 3 parts, but part 1 is a recap of session 2. So I will do that in a bit of, not detail, but try to get those who haven't been able to join in those sessions to get a flavor of what was discussed during that time. So the next slide, please. So an overview of diet and nutrition in thalassemia. It's really important to understand how nutrition fits into thalassemia, and specifically in relation to the clinical features of thalassemia. And many of you will know, so you obviously, those who've watched the presentations before, you would have seen these slides, but for those that are new, the first part is just looking at what are those clinical features in thalassemia that actually relate to the nutritional implications in the condition. So ineffective erythropoiesis, a big word, but it means the erythropoiesis refers to the process of making red blood cells. Chronic hemolysis is another clinical feature, and this is literally the rapid breakdown of red blood cells, resulting in the chronic anemia and the hypercoagulability associated with that. We know that primary iron overloading is a problem in thalassemia because of the regular blood transfusions that you have to have, the 2 to 4 weekly blood transfusion regimes. And there's also what's called extramedullary hematopoiesis. And again, hematopoiesis refers to the formation of blood cell components outside of the bone marrow. You will also know that the 2 main types of thalassemia is transfusion dependent, and the other one is non-transfusion dependent. But we know also that some patients with non-transfusion dependent thalassemia with a severe phenotype may also require regular blood transfusions. So the nutritional implications, this next part is just a summary of the topics that we would cover over the 4 sessions. So you can see there, the first session was looking at iron overloading, relating to anemia, malnutrition, and growth failure. Last week was, 2 weeks ago, 4 weeks ago now, actually, we covered the endocrine problems, specifically looking at pancreatic insufficiency, diabetes, hormonal imbalances. Today, as I mentioned before, we will look at bone health, osteoporosis in the context of bone health and immunity. And then the 4th session will be on major organs, including the gastrointestinal tract. The next slide, please. So again, an overview of iron overloading. You may already know this, but this just as a refresher in terms of recapping. So the clinical effects of related to iron overloading is the buildup of iron in vital organs in the body, such as the liver, the heart, and the endocrine glands. There's also side effects in relation to the chelation treatment that can also have an impact on the nutritional effects of thalassemia, but also to note that there's a wide range of nutritional implications related to thalassemia and its treatment options, which is what we've covered over the last 2 sessions and also today and session 4. But the etiology or the cause of the nutritional effects in thalassemia is multifactorial, as stated there. And it can be associated with poor nutrient intake, so in relation to poor appetite, cultural preferences, decreased nutrient density, and gastrointestinal distress, increased nutrient requirements, and that's in relation to the red cell turnover, which I mentioned, that chronic hemolysis, that rapid breakdown of the red blood cells, but also oxidative stress, which is a side effect of this chronic hemolysis as well. And then you also have increased nutrient losses as a consequence of these processes that are constantly happening in thalassemia patients. The next slide, please. So a brief overview of the nutritional considerations in the context of growth failure. Again, the causes are multifactorial. It's related to malnutrition and specific nutrient deficiencies. It's also related to the severity of the anemia that you may experience. And again, the anemia affects the availability of oxygen to the cells, the tissues, and the organs of the body. When you experience growth failure, you're not able to maintain normal growth and development. It affects your energy levels and your normal activity or your ability to for activities of daily living, and also affects the ability to lead a good quality of life if not treated promptly. So growth failure is a significant problem. And then looking at the nutritional clinical considerations in the context of growth failure, the recommendation is that the pediatric patients, they need to be assessed for their growth every 6 months, and this is to correct anemia and also to monitor the iron overload and the iron chelation to reduce the effect that it has on growth failure. Also to ensure adequate calorie intake, and so ensuring that on a daily basis that the children are given energy-dense foods, including protein-rich foods, vitamins and minerals, in particular zinc, folic acid, vitamins like vitamin D and vitamin A as well. And you will see later on in the talk how these vitamins fit into in thalassemia and the problems related to thalassemia. And then also very importantly, to ensure that the families have support in order to manage, the difficulties associated with the problems, that you may experience in relation to growth failure and the other problems as well. So looking as well at the psychological, the social, and the emotional needs of both the family as well as the patient. The next slide, please. So the last session, we looked at the endocrine. So if you just move forward again, Brawana, yeah. So the last session, we looked at the endocrine problems and we looked at the causes of them. So again, it's a side effect of the iron overloading that many patients experience, and also ineffective iron chelation. The main problems that we identified the last session was the pancreatic insufficiency, and particularly in regards to that is the impact it has on the main enzymes, the digestive enzymes released by the pancreas, such as lipase, amylase for carbohydrate digestion, and proteases to digest your proteins. Also, the pancreatic insufficiency results in type 1 and type 2 diabetes, but also it has an impact on the hormonal imbalances such as hypothyroidism as well as hypogonadism. So what are the nutritional implications in relation to the endocrine problems? So specifically malabsorption of nutrients. As I said, with the pancreas, there is a reduction in the digestive enzymes, and that results in patients not being able to absorb key nutrients and key such as protein, fats, as well as carbohydrates. There's impaired digestion, impaired glucose control, as we've seen with diabetes, dyslipidemia, as well as an increased risk for cardiovascular disease, which we spoke about in a bit of detail the last time, but also in relation to the hormonal functioning that results in the delayed pubertal maturation. The next slide, please. So I thought I'd highlight again pre-diabetes, just because it's so important. If you can prevent diabetes, it's better than actually being able to manage it. So I've included the slide again. So what is pre-diabetes? Very briefly, it's an intermediate state of glucose control, and patients have a higher risk of developing diabetes if they have pre-diabetes. And it's about the presence of blood glucose levels above the normal, but not above the diabetes threshold, as you can see there. And the way to test this is using a glucose tolerance test, or GTT, and you can see the reference readings there as well. Again, as I said, prevention is better than cure. So in the context of pre-diabetes, we said that to follow a healthy lifestyle and a good diet is critical. To engage with regular physical activity, and we'll speak a little bit more about the physical activity. To avoid smoking if you're not smoking, but also to stop smoking if you're already smoking. Have good blood pressure control or improved hypertension, and then also to achieve and maintain a healthy weight, and to address the dyslipidemia. Next slide, please. This slide I included because this was just to show you almost the carbohydrate distribution of your meals, particularly if you are at risk of diabetes, like we've just discussed with pre-diabetes, or if you already have diabetes. And you can see in this plate there that the emphasis there to have more non-starchy carbohydrates, so your vegetables and your salad vegetables, so half of your plate to have that. A quarter of your plate to have your starchy vegetables, and then a quarter of the plate to have protein, because normally what we would have is the reverse. We would have half of the plate having your starchy carbohydrates, and then you'll have protein and maybe a slither of the vegetables. But you can see, to help reduce and improve your glucose control, your blood sugar control, this is what is recommended, the distribution. The next slide, please. So just to end off with the overview from last time, so looking at the hormonal imbalances, and I wanted to highlight this, it's particularly because hypothyroidism leads to an increase in blood fats, such as cholesterol, LDL, which is low density lipoprotein, and this is also known as bad cholesterol, that increases your risk of heart disease and stroke, triglycerides, as well as lipoprotein A. And as I said, this does increase your cardiovascular risk. And in addition to that, we have a reduction in the parathyroid secretions, which results in hypocalcemia and hypophosphatemia. Hypo meaning low, so you'll have low calcium levels and low phosphate levels, and you will see that low calcium levels does have an impact on your bone health and your bone risk, and you'll see that later on in the presentation. And so the recommendation is for you to choose healthier fats, such as mono and polyunsaturated fats, including olive oil, rapeseed oil, and then also omega-3 rich foods, so both oily fish, walnuts, but also the plant-based oils such as flaxseed, chia seed, soybean oil, and canola oil. So looking at hypogonadism, again, it's associated with nutrient deficiencies, and the recommendation is that you check and correct levels, particularly for zinc, vitamin D, and selenium. And again, you will see that later on in the presentation that this is important in the context of immunity as well as bone health. The next slide, please. So again, just briefly, I wanted to highlight some of the key healthy eating principles, and it's particularly looking at the 5 food groups, because all of the decisions and choices that you'll make in relation to food sort of hinges around the foods from these 5 food groups. Again, this is just revision for those people that have heard the talk before, but if you're new, just to give you an overview as well. So the 5 food groups, the first group you'll see is carbohydrates, and that's the yellow group in the picture there. And foods that come under this this food group is things like starchy foods, breads, chapati, dosa, thepla, semolina, tapioca, cereals, potatoes. So those are all your starchy foods. Then you have the green group, which is your fruits and vegetables, and you can see that those 2 groups are bigger, so we need to choose more foods from those groups, which is why those groups, food groups are slightly bigger in the picture. Proteins, so that's the pink group there, you can see. So examples are beans, pulses, dal, besan, soya chunks, soybean, protein fish, eggs, and protein alternatives. And then for the dairy, which is the blue group, things like milk, milk alternatives, peony, lassi, cheese, yogurt. And then you can see the little slither there, fats and oils. And around the image there, you will see that there's water, again, just to indicate the importance of having enough water on a daily basis, but also reading your food labels, and you will see why later on that's important as well. But also on the outside of foods that contain high fat and sugar, to say that it's not that you can't have those, but to have those less often and in smaller portions. The next slide, please. So a summary of the key nutrients for healthy living. So coming back to the carbohydrates, so both the starchy foods as well as your fruit and vegetables will come under this umbrella of carbohydrate foods. They are the best source of energy for all body functions that you can see there, for the brain, the central nervous system, digestion. So we need, it's the main fuel source of the body, carbohydrates, particularly going for complex unrefined carbohydrates, so whole grains, and foods that have a higher fiber content is recommended. Looking at the proteins, again, one of the most important nutrients to maintain good health and vitality. And in the context of thalassemia, important for growth and development. It's part of all tissues, so you can see how important it is: bones, nerves, hair, skin, hormones. So it's important that you take in a good amount of protein in the diet. And if we don't take enough carbohydrates in the diet, then the body will start using protein for energy. So it's important that you're taking enough carbohydrate food so that you're sparing your protein to be able to be available for building and repairing the tissues and the body organs of the body. So moving on to vitamins, as I said, they're absolutely necessary for proper growth, maintenance of health, prevention of disease. Can't be made by the body, so it is dependent on you taking enough in the diet, particularly from that fruit and vegetable, the green section that I spoke about earlier on. Similarly with minerals, it's an important part of healthy living. And again, it needs to be taken in through the diet, but it's an important part of lots of the biological processes in the body. As you can see there, muscle response, digestion, the co-production of hormones, etc. So really important that we take in enough of these vitamins and minerals. I mentioned about water. Again, our body is made up of over 70% of water. So if you're not taking in enough, then, you know, we can pick up problems down the line, but also ensuring that we're taking enough fiber as well. The next slide, please. I've included this again, and I will continue to include it because it's helpful, particularly for those of you suffering with iron overload. And so the recommendation is that you do limit the amount of iron taken in through the diet, but importantly as well to be compliant with your iron chelation regime. And I've just said there that some patients that are non-transfusion dependent, they may also develop iron overloading due to absorption of iron from the gut. So just to highlight that as well. So what can be included in the diet? So you can have your fruits and vegetables, as I mentioned earlier, grains and legumes, eggs, importantly, lean protein sources like chicken and turkey. I know from before, people have said that they really enjoy red meat. So that will depend on how well you are iron chelated and what your ferritin levels are like in terms of what you can, you know, if you can allow to have a treat of red meat, but ideally not. And then to have tea and coffee with meals, because that will help to reduce iron absorption, as well as reducing the intake of vitamin A and vitamin C rich foods. Importantly, to read your labels to check whether foods have been fortified with iron, and also avoiding supplements containing iron. The next slide, please. I've included this slide because one of the attendees from the last session was asking about iron overloading in the context of menopause, and this person was in particular taking a green smoothie. I think it was every day. She was saying containing spinach, kale, apple, celery, and banana. And I've included on this slide almost a comparison between kale and spinach to show you the various nutrients that's in there. And in particular, highlighted vitamin A and C, because on the previous slide, I said that they can increase iron absorption. It also contains iron. So again, you know, being mindful of what are your ferritin levels, how well are you chelated, and that will determine sort of, you know, how, if you can have it and how often you have it. I've added a little bit of information on menopause, not going to say a lot on it, but I just wanted to highlight that because we're talking about bone health and we've spoken about heart health in the last session. With menopause, you are at a higher risk for bone and heart related problems. So just wanted to highlight that, but also the recommendation is that you can include in your diet plant estrogens from soya and linseeds. And this has also been shown, if you take it sort of 3 times a day, not one lump like once a day, but maybe over 2 to 3 times a day, that can have a beneficial effect on your heart health. But I just wanted to include this because I know this was a question that was asked in the last session. The next slide. So we're going on to part 2, which is the main part of the talk. And so I'll try and whiz through this as well. The next slide, please. So diet and nutrition in bone health. So just to give you an overview of so how bone health and immunity it sits in relation to thalassemia. The next slide, please. So when it comes to bone health in thalassemia, the majority of the patients are at risk of low bone mass. I do have a slide to show you what bone looks like, but I'll go through these slides first before I get to that. And so what's important to note is that it increases your bone, the risk of this low bone mass increases with age. There's reduced bone formation, and there can also be a reduced rate of the accrual of bone mineral. This can lead to bone disease becomes an important cause of morbidity for many patients, and also associated with pain, easy fractures, and also for some patients, the collapse of vertebra. So a really serious problem in the context of thalassemia. So the problem with low bone mass and sort of bone disease in thalassemia, it can severely affect the quality of life of patients. And so important here to say is that vitamin D deficiency, we know because we've said that from previous presentations, that vitamin D deficiency is common in people with thalassemia. And this can be the case even though you may live in a country with high or good amounts of sunshine. And therefore, in thalassemia, a routine prescription of vitamin D is recommended rather than just having it sort of, occasionally. It is advised that you have that on an ongoing, sort of on a daily basis. And this is important because vitamin D actually helps with calcium absorption. And we know also that there's impaired calcium homeostasis as a result of iron overload. So there's more benefit, or there's added benefits, for you being compliant with taking your vitamin D on a regular basis, because as I said, not only in the context of bone health, but also it's important for calcium homeostasis and calcium absorption. So in thalassemia, we know that iron overload, and there can be, obviously, there's iron overload, but also if there's suboptimal transfusion, this can lead to what's known as osteopenia, and that relates to the level of bone density. Can also be caused by focal osteomalacia, and osteomalacia is basically a metabolic bone disorder, and this can result in reduced bone synthesis or reduction in the synthesis of bone. So low vitamin D is associated not only with bone health, but it's also associated with a number of other functions, such as decreased cardiac function, muscle weakness, glucose insensitivity, and refractory congestive heart failure. Even more reason why it's important for you to be compliant with your vitamin D supplementation or regular vitamin D supplementation. The next slide, please. So immunity in thalassemia. So thalassemia major is associated with an increased risk for serious infections. And, there's a whole host of problems or defects within the host or the body's defense mechanisms that contribute to this increased risk of infections in thalassemia patients. So the infections are related to iron overload, the chronic stimulation of the immune system by repeated blood transfusions, splenectomy, which is the surgical removal of the spleen, and as well as immune deficiency. So there's a range of causes that can result in the infection as well. So a number of key elements and processes of the immune system is affected in thalassemia. And in one paper I read that the frequency of the complications related to infections in thalassemia patients is up to from 12 to 13%. And in some cases, this can be fatal as well. So in beta thalassemia major, there's an increased risk for systemic infections, and this means that it can affect the whole body, so that all the systems of the body can be affected. And as I said before, there's various causes of these infections, including what I've already mentioned, the iron overload, the splenectomy, and there's also abnormal functioning of the immune system. The next slide, please. The next slide. To look at the nutritional management. So so bone-related problems in thalassemia. So we'll look at the clinical features as well as causes and risks, but start with the clinical features. So bone is a living, growing tissue. I don't know if you've looked at bone or thought of bone in that way, but it is a living and growing tissue, but it changes throughout the lifespan, and that's important to note. And this results in a loss of bone density or loss of bone mass, containing abnormal tissue structure. And again, as I said, I'll show you an image to make this a little bit clearer. So the image of bone is described as a honeycomb with holes and spaces, and the holes and spaces can become much larger, you know, than healthy bone. So when you've got problems related to bone health, those holes and spaces become much larger. And the bone therefore becomes less dense, they become weaker, and they're more easier or likely to break. So what are some of the causes and the risk factors? The body can lose too much bone is a cause, but it can also make too little bone, or it can be a combination of both. And in that way, the bones become weak and they can break, even from you sneezing or a major bump, particularly depending on how thin the bones have become. And thalassemia, as we know now already, is one of the main causes of bone-related problems, specifically osteoporosis. The next slide, please. So as I mentioned, this is an image of healthy and unhealthy bone. And so you can see on my left, that is an image of healthy bone. So it's like that honeycomb effect. You can see the spaces in between there. But if you look to my right, the image to my right, you will see the big gaps that is formed in the bone tissue. And that is how they describe the thinning and the brittle, where the bones become thin and brittle and fragile, because that spaces and that holes that they speak about has become bigger, and also then affected the density or the mass of the bone. The next slide, please. So osteoporosis is one of the key problems in relation to bone health in thalassemia. So the next couple of slides will focus on that specifically. So again, looking at the clinical features, because it's so important to understand that side of osteoporosis. So in osteoporosis, it's a disease, but there's decreased bone strength and mass. And if you just take your mind to the image I've shown you, you can understand why that is the case. And this results in significantly increased risk of fractures. So when you're looking at the medical, nutrition, and lifestyle management, the recommendation is that we take a whole person approach. So not just looking at nutrition, so looking at sort of all the factors that can actually play a role in, the risk of fractures and problems related to that. So researchers have found strong evidence supporting a positive effect of calcium intake, as well as physical activity on bone accumulation and growth. And we'll talk a little bit more about that in another slide. So they suggest and recommend for regular participation in exercise, foolproofing your home. So if you know that you are at risk, foolproofing your home, so to reduce the risk of you knocking yourself or having accidents in the home. Avoiding smoking, which is something I mentioned earlier on as well, but also avoiding excess alcohol, to reduce the risk of accidents, tripping, etc. The next slide, please. So osteoporosis in the context of childhood and adolescence, and particularly prevention. So they do say that prevention begins in childhood. You don't want to get to your older, sort of later in life, to pay attention and to put in place, preventative actions. You want to prevent osteoporosis from childhood, because that is the bone building years. Childhood and young adults is when you develop what's called peak bone mass. And this is the greatest amount of bone a person can attain. And this happens sort of from the childhood sort of stage, like into the late teens and early 20s. And so that's why prevention is important at this particular time. So children and adolescents with a high peak bone mass is known to have a decreased chance of developing osteoporosis in later in life. And so you can see that prevention is really vital in the context of reducing your risk of developing osteoporosis. So what can you do in terms of diet and lifestyle? Again, providing a well-balanced diet. And if you take your mind to the slides that I spoke about earlier on, looking at the different food groups and choosing food from the different food groups, it's important even in the context of preventing and reducing your risk of osteoporosis. So providing a well-balanced diet, having calcium-rich foods, and we'll go into detail in a couple of more slides with what those foods are. Ensuring that the child gets enough vitamin D. We spoke a little bit about vitamin D and vitamin D supplementation that is needed on a regular basis. Ensuring the child is physically active, and also, important to stress sort of good lifestyle choices, and particularly in relation to smoking and alcohol. For the older child, not the younger child, but for the older child. So prevention is key in regards to osteoporosis. The next slide, please. So looking at osteoporosis, the diagnosis thereof and the tests that's used. So one of the key tests used is one called bone mineral density test. You may have already been referred to have one of those. And these tests, basically, they measure your bone mineral density. And this is essentially the amount of bone mineral that you will have in a certain area. So you can see that these tests can be done in different parts of the different bones. So hips, spine, forearm, the wrists, finger, heels. So yeah, some of you would have had these tests already. And then other tests that you can have, so bone scans, some people may be referred for bone scans, x-rays, as well as biochemical marker tests, so taking blood tests and having a look at certain markers in those blood tests, things like calcium, phosphate as well. That will be relevant under the biomedical markers. The next slide, please. I think there was a question about the age for having these bone mineral tests. We know that, there is a risk in relation to thalassemia, particularly in relation to vitamin D. Vitamin D and calcium is key nutrients for good, strong bones. And so I would imagine that this would be part of your annual review tests. And prevention is better than cure, as we said in the previous slides. And bone deposition and growth starts with childhood. And so I would imagine that those tests would be happening sort of from an early age, or at least sort of looking out for the risks for patients from an early age. So looking at key nutrients, in relation to osteoporosis, I mentioned calcium already. So what's the function of calcium? It's essential to build strong, dense bones and teeth and keeping them healthy. It's necessary for life. So in addition to its function in bone health and keeping it strong, it's important for clotting, muscle contraction, helps the heart to beat healthily, and also 99% of calcium is found in our bones. So other functions of calcium, so it can be lost daily through our skin, through the nails, hair, sweat, urine, and feces. But importantly, as I've mentioned before, it can't be produced by the body, so you do need to take it in through your diet. If you don't take enough calcium through the diet, then the body will actually start taking it from the bones. And we already know that there's an increased risk, for patients with thalassemia, for osteoporosis or bone thinning. So we don't want to, increase the risk for that. And therefore, it's important that you do take a daily adequate intake of calcium, and that is to reduce bone loss, to reduce low bone density, and also to reduce the risk of broken bones. So calcium is an important nutrient in osteoporosis prevention as well, and management. The next slide, please. So some sources of calcium. So calcium-rich diet will include dairy products, nuts, green leafy vegetables, as well as fish. And for fish here, it would be fish like sardines that contain soft bones. So that you can mash and you can sort of eat with the fish. But some of the better sources of calcium, as already mentioned, is dairy products. So milk, yogurt, cheese. I know there's some patients who are vegetarians or vegans, they may not have this. And so in those cases, you can have soya milk or other nut-based milks, almond or oat milk, that is fortified with calcium. But it's important to check that they are fortified with calcium. So calcium can be found in some green vegetables as well, but also in some juices, breakfast cereals. Again, check the box to see, read the label to see whether it has added calcium or it's been fortified with calcium. Some bottled water also contains added calcium. So a tip for you in relation to increasing the calcium intake in your diet. So that can be by adding a single tablespoon of non-fat powdered milk. And the powdered milk you can get from your supermarkets. So by adding a tablespoon of non-fat powdered milk to your drinks or to your food, you can actually add 50 milligrams of calcium. So that's a quick and easy way, and for little ones as well, for growing children, but also for adults, a quick and easy way to bump up your calcium sort of intake as well. And as I mentioned before, read your labels as well. So in regards to supplements, there are risks attached to taking calcium supplements, and that can be constipation, kidney stones, and occasionally can lead to excess heart calcification. So the recommendation is to try and get your calcium from the diet rather than taking it from the supplements. There will be patients who will need to take a calcium supplement. So just be mindful of those potential risks with that. The next slide, please. So the second key nutrient is vitamin D. And again, we look at the function and sources. So vitamin D is a fat-soluble vitamin, and it plays an important role in protecting the body. But as I mentioned before, it helps the body to absorb calcium. So it plays a really important role in preventing and managing osteoporosis, but also supports muscles needed to avoid falls. So there's lots of additional functions to vitamin D, but importantly, it helps with calcium absorption. Children need vitamin D to support strong bones, but adults need vitamin D to keep their bones strong and healthy. But as I said before, it's about prevention. It's about, ensuring that the children from a young age get enough of the vitamin D from their supplements. So, having compliance with that is important. So in relation to deficiency, many of you will know some of these things already. We know that vitamin D is made from exposure to sunlight, but living in the UK, that is a problem because we don't have a lot of sun exposure. But as I mentioned before, you may live, particularly if you're thalassemia, you may live in a region that has quite a lot of sunlight, but you would still need to have regular vitamin D supplements. There's certain medical conditions that can result in deficiency, and thalassemia, sickle cell disease, some other conditions. We know that there is deficiency of this vitamin, of this nutrient. People may take medication that can affect vitamin D absorption, so to bear that in mind. Patients or people with a darker skin tone can have a deficiency of vitamin D, but also patients that are obese or overweight, those older adults, particularly those living in nursing homes and institutions where they may not, have exposure outside as well, they can also have an increased risk of deficiency. The next slide, please. So looking at sources of vitamin D, we spoke about the sun, but we also spoke about the fact that even though you can be exposed to sunlight on an ongoing basis, you may still have an increase a risk for low vitamin D levels. The time of day that you are in the sun plays a role. The season, your skin pigmentation can play a role. And looking at then the key sources of vitamin D in food. So there's very few foods that actually contain vitamin D, but some of it may includes fatty fish. So your oily fish, your mackerel, salmon, for example. But it may be, vitamin D may be added to milk and other dairy products, orange juice, soya milk, fortified cheeses. So as I said, to read labels and to check if food has been fortified with that. And as I mentioned before, it may be difficult, to get enough sunlight exposure and from food. And so definitely taking supplements is the way to go. So there's two types of supplements, and both of these are good for bone health. The first one is vitamin D2, also known as ergocalciferol, and vitamin D3, known as cholecalciferol. And the recommendation is that you take these supplements with food. The next slide, please. So I mentioned before about physical activity, and they've done some studies in looking at physical activity in non-cell patients, and they found lots of benefits to physical activity, specifically in relation to the maintenance of weight, a healthy weight, improved balance for patients, improved bone and heart health, improved glucose tolerance, and also reduction in anxiety and stress. So we can see there that there's lots of really useful benefits of engaging in regular physical activity. But in FAL patients, there have been studies conducted in Greece, Italy, and the US. And these studies have reported reduced physical activity in thalassemia patients as compared to healthy counterparts. And a number of factors have been identified to contribute to that. And some of them include pain. So patients don't engage in physical activity because of experiencing pain. Those experiencing chronic severe anemia. Fatigue is a big influencing factor as well. Patients just don't have the energy to engage in activity, but also deconditioning from not using your muscles. And as mentioned there, there's a decrease in exercise capacity. So these are some of the factors that have been identified. And so research that has been conducted also demonstrate there's some sort of benefit for physical activity for adults with thalassemia, and this has been associated with improved quality of life, less pain over time. That is, you may experience some pain initially if you've not done any exercise before, or if you're deconditioned, it may be more difficult for you to start. But I guess once you start and you keep doing a little bit at a time, that will improve. And also it's shown to have a reduction in serum ferritin and a higher bone density. So we can see that just as there's benefits for physical activity in non-thal patients, there is some benefit for regular or engaging in regular physical activity for patients with thalassemia. But as I mentioned, it may be difficult in the beginning, but it may be helpful to sort of consider or reconsider sort of what you can do within your capacity to engage in physical activity. The next slide, please. So looking at immunity, some of the risk factors. So if you're living, not if you're living with thalassemia, you're on the call because you do have thalassemia, there's a couple of sort of clinical factors that can increase your risk and your immunity as well, and particularly for patients who may have indwelling ports or lines, things like Porticats, PICC lines, because there's opportunity for foreign bodies or bacteria to sort of enter where those lines have been inserted, so that can increase your risk. But also patients who've had splenectomies, the removal of their spleen. thinking about penicillin coverage, so antibiotic coverage. Are you taking it regularly or not? And the recommendation is, if you're not taking it regularly, that you don't take it. It's either you take it consistently or not at all. Are you up to date with your immunizations? And also, if you do have diabetes and it's not well controlled, this can also sort of influence the immunity and the level of immunity, because with diabetes, particularly uncontrolled diabetes, you will have higher sugar levels in the blood, and certain bacteria actually feed on sugar. They use sugar as their fuel. So that can have an impact on your level of immunity as well. But also pathogens love iron, and we know that in thalassemia, iron overloading is a problem. And so you can see that there's a whole risk level of factors that actually increase your risk, in terms of your immunity and how well the immune system works and supports you. So in regards to nutritional management, looking at some of the risk there, the impact of malnutrition. We know that infection risks can actually increase your risk of malnutrition. That can increase your energy requirements or nutrient requirements as well. But also considering the gut microbiome or the environment, in the gut, where you will find your both healthy and your unhealthy bacteria. And also thinking about specific building blocks that is important for to ensure a good immune system. And the next slide will cover some of those in a bit more detail. The next slide. So this is a slide I've put together. I attended a presentation on immunity, and I thought it really summed up sort of the what immunity is and how it develops, and the fact that it declines over time. But important to remember in regards to immunity that it takes a lot of energy. The immune cells are very active, and they have high energy requirements. And so if you are recovering from infection or surgery and you're not eating well and you have a reduced appetite, that can have an impact on how well the immune system can work, knowing that it is very active and that actually it requires high amounts of energy. And where does the body get that energy from? It will draw the energy from the body stores, and it will get it from your diet. So again, if your diet is lacking, you're not taking enough energy through the diet, or you are at increased risk of malnutrition, that can impact on the available energy levels that you have, for your immune system to work as effectively or efficiently. So I thought that was really important, just to highlight to you as well on a general sort of level. If you're looking at the microbiome, as I said, which is the environment where you find both your good bacteria and the harmful bacteria, and how it's colonized. So it's important that you keep your immune system, or that the immune system is working as efficiently or as well as it possibly can, because that plays a role in your ability to block the harmful bacteria or the pathogens that can enter into the body. As I mentioned, in thalassemia patients with PICC lines or Porther cats, there's always this opportunity where, these pathogens or harmful bacteria can enter the body in that way. But also, the environment in which you live can also have a role in, how healthy your microbiome is. If you have pets, that can have a role to play. If you're on antibiotics, that can influence sort of the immune system as well, and how well it's able to function. But also introduction to foods, different foods, food health, food hygiene is important. But also, even from birth, when children are born, in that time frame, sort of pathogens and bacteria can be introduced at that point as well. So I want to move over to the specific building blocks that can help to support. So if you just go back again, yeah, thank you. I just want to finish this last bit. So looking at specific building blocks for the immune system, thinking about fatty acids, particularly omega-3 fatty acids, that's known to help with immunity. Vitamins and minerals such as vitamin A and zinc is helpful as well. Amino acids, particularly arginine, is an important building block, but also functional foods such as probiotics and prebiotics. And the next slide, I'll go into a little bit more detail about probiotics and prebiotics. The next slide, please. So this is just additional information to give you. You may have heard of probiotics and prebiotics. So this is just a summary slide for you for your information. So in relation to probiotics, what are they? They're beneficial bacteria. So they are live bacteria that are found in certain foods, and the best strains identified are those that include Lactobacillus acidophilus, and they provide numerous health benefits for all of us, essentially. And so examples of probiotic foods include yogurts, high quality plain yogurt with live cultures, particularly the one I've mentioned up top, the Lactobacillus strain. Fermented foods, including sauerkraut, kimchi, kombucha, tea, kefir, some type of pickles, as well as pickled vegetables. So just to give you an example of where you can find probiotic foods. But then prebiotic foods is actually the food that these beneficial bacteria feed on. And they, again, come from certain types of carbohydrates, mostly fiber, and the type of fiber that the body can't digest. So the beneficial bacteria in the gut, they eat this fiber from these foods. So examples of foods that provide, or prebiotic foods, includes vegetables, for example, Jerusalem artichokes, leeks, onions, asparagus, fruits such as bananas, berries, legumes, beans, peas, and oats. The next slide, please. So again, just a slide to demonstrate or highlight the benefits of gut bacteria or healthy gut bacteria. So why is gut bacteria beneficial? It helps the gastrointestinal tract from harmful bacteria and fungi. It can also help the immune system work more efficiently. And it can also, some research has shown that it can improve symptoms of depression and help with addressing obesity as well. And some gut bacteria can also help with the synthesis of vitamin K and short-chain fatty acids. So you can see that there's a lot of added benefit for ensuring that there's good bacteria in the gut. There's a term called synbiotic, and this is basically when foods contain both this beneficial bacteria, but also the prebiotic source of fiber, the food that the good bacteria feed on. And examples of this is cheese, kefir, and sauerkraut. And just to say that it's important to balance the good and the bad bacteria in the body, and to do this, it's to ensure that you eat plenty of both the probiotic, which is the healthy and the good bacteria, but also the prebiotic foods, the food for these healthy bacteria. The next slide, please. So nutrients linked to immunity and thalassemia. So just to highlight again that in thalassemia, it's been known that patients have or can be deficient in zinc. And this is documented in both patients who are transfusion dependent as well as non-transfusion dependent. And the etiology or the cause of this is inadequate intake, elevated urinary zinc excretion, so how much zinc is excreted in the urine. Iron overload can result in this lower levels or deficient levels of zinc, as well as a reduction in the zinc binding capacity and the increasing requirements. So zinc is important for linear growth in children. So you will have your levels tested just to sort of see, what they are. But also it's important for bone health and reducing the risk of diabetes in some adult patients. And we spoke about that, I think, in the last session as well. So antioxidants, I don't know if I've mentioned in this talk, but oxidative stress, I think I mentioned this when we spoke about the chronic hemolysis that we find in thalassemia, which is the rapid breakdown of red blood cells. A consequence of that chronic hemolysis is oxidative stress. And the oxidative stress is actually an imbalance of harmful substances that can cause damage to cells, cell membranes, and it can also lead to chronic inflammation. And so oxidative stress is a primary phenomenon in thalassemia. And this can lead to early cell death, as I've just mentioned, both in red blood cells and other vital tissues, and then can lead to irreversible organ damage. So we do want to look at sort of keeping the impact of the oxidative stress as low as possible. The next slide, please. And so looking at thinking about oxidative stress and how we can reduce the impact of this, the next couple of slides will be looking at building the antioxidant system in the body, building up the immune system, and also reducing inflammation. The next slide, please. So key nutrients in relation to immunity, thinking about the deficiencies that we've mentioned already in terms of zinc and selenium. So looking at the function and the sources of zinc. So we know now it's not stored in the body and therefore it must be taken in through the diet. So key sources for zinc is meat, milk, cheese, eggs, shellfish, nuts and pulses. But also fortified breakfast cereals. So again, reading the labels to see if your breakfast cereals you're having at the moment is fortified with that. Baked beans and chickpeas. In particularly plant products, the absorption can be affected by phytates, tannins, and calcium. And so to be aware of that as well. You will have at some point, I would imagine as part of your annual reviews, have your baseline zinc levels checked. And obviously if it's deficient, then to correct with either supplements, but also to maintain that through your daily diet as well. So thinking about selenium, the function and sources. So again, it's needed as part of a healthy diet, and some of the sources there. And actually, I've got some Brazil. You can't see my camera, but I've got some Brazil nuts next to me. So a really good source of selenium is Brazil nuts, oysters. No, I don't know if many people eat oysters, but I don't. But yeah, oysters, tuna, eggs, sardines, sunflower seeds, and mushrooms. So are good sources of selenium. Just to note that there's the quality of your plant sources of selenium does depend on the quality of the soil. So just to bear that in mind, and also to be aware of toxicity of the soil as well. So the next slide, please. So coming on to the key nutrients in relation to antioxidants. Now, many of you will read this and think that it's a bit of a contradiction, because if you remember earlier on, I was talking about for those patients with iron overloading, I said to reduce the intake of vitamins A and vitamin C because they increase the iron absorption. So again, when you're listening to the slide, so just bear in mind, if you do suffer with sort of iron overloading, which I know many of you will, so just be mindful of how much and how often you're taking in these nutrients that contain vitamin A and C in particular. But these vitamins, the vitamin A, C, and E, they are known as sort of the natural antioxidants of the body, and they can work to reduce the effect of oxidative stress. So we've just mentioned, we've gone through zinc and selenium and also vitamin D and calcium already, but just to say that these nutrients together with vitamin A, C, and E, they all work to improve and help with sort of normal functioning of the immune system. So looking at sources of these specific vitamins, particularly vitamin A, so good sources of that is dark green vegetables, yellow, orange vegetables, tomatoes, watermelon, apricots, and peaches. So you'll see the color there, oranges, orange sort of color vegetables, particularly contain vitamin A. If you're thinking about vitamin C, so vegetables such as broccoli, green leafy veg, peppers, your citrus, fruits, berries, cantaloupe, strawberries, they're rich in vitamin C. And as I said, just be mindful, you know, if you are struggling with sort of high iron overloads, and also if your ferritin levels are really high, then I would say to maybe reduce your intake of particularly these two groups of foods. But vitamin E, good examples or good sources there is foods like avocado, vegetables, eggs, grains, nuts, seeds, legumes, vegetable oil, and wheat germ oil. I particularly like to have a sandwich with avocado and egg. It's a really good combination for me. So, but just to share that to you. And then just at the bottom there, you'll see there's a list of antioxidant foods, other foods, in particular things like cloves, olive oil, nutmeg, cumin, garlic, and ginger. And many of you may be using this in your cooking already. Licorice, spinach, chili, peppers, avocado, basil, kale, and apricot. So these are other sort of foods that also have an antioxidant effect on the body. So if you can't have foods from vitamin A and vitamin C, maybe concentrate on these other ones at the bottom. The next slide, please. So anti-inflammatories, particularly looking at your omega-3 fatty acids, and particularly they are known to help with reducing the inflammation. Remember, I said in the beginning that oxidative stress can increase or lead to chronic inflammation. So it's a good, it's important that we try and increase the intake of omega-3 fatty acids to help reduce the inflammation associated with that. And I've just listed the types of the three main types of fatty acids. So the abbreviations are there. You can see I've put the names in brackets. They're not easy to pronounce, so you can use the abbreviations DHA, EPA, or ALA. The ALA, the alpha linoleic acid, are in the examples are plant sources of omega-3. So looking at the sources, as I mentioned there, so omega-3 is your oily fish, your salmons, your sardines, tuna, mackerel, herring, trout. But your examples of the ALA or your plant sources there include flaxseed, chia seed, hemp oil, walnut oil, and canola oil. And I've put the dosage there on average is between 250 and 500 milligrams. That's the dosage. The next slide, please. So I've added this third slide or this slide just again for additional information in relation to other sort of food sources that can provide analgesic or pain sort of properties, as well as antibacterial properties. So in relation to analgesic sources, if you just go back again for me, please, thank you. So examples there would be chili peppers, cinnamon, clove, garlic and ginger, aniseed, peppermint, licorice, and coffee. So many of you will probably have some of these already, particularly if you're using in your cooking, garlic and ginger in your cooking, chili peppers, that has been shown to have some analgesic properties, as well as if you're looking at the antibacterial properties. So again, chili peppers is identified there, garlic and ginger, honey, nutmeg, licorice, flaxseed, apple and banana. So this is just additional sort of food sources that you can sort of consider in terms of, you know, the antibacterial properties as well as the pain or analgesic properties. The next slide, please. So I've whizzed through, it looks like we will get through the presentation sort of, yeah, this evening. So part 3, I like to end off the presentation with some lifestyle and empowerment tips. And if we move on to the next slide, please. So the next one. Thank you. So thinking about bone health and immunity, which is the focus of today's talk in particular, I thought it's helpful to think about what you can do moving forward that can actually help to improve your bone health, to prevent sort of your osteoporosis, and also to improve your immunity. So thinking about things, we spoke about physical activity, and I mentioned the positive or the benefits of engaging in physical activity. Maybe if this is something that you're not already doing, maybe this is something that you can consider sort of engaging in on a more regular basis. What I will say to that is pace yourself. If you're not already engaging in physical activity and this is something new that you're starting in, it's important to start slow. Maybe start with a few minutes, maybe start with 5 minutes and keep going with 5 minutes until your body is more conditioned and, you know, you feel you are able to do a little bit more. But maybe thinking about, you know, physical activity in regards to self-care and what you can do. If you find because of fatigue and tiredness, you're not able to do sort of more physical or active, you know, walking, maybe thinking about chair-based activities, you know, maybe taking, you know, either weights in your hands, maybe a can of something or water bottles in both arms while sitting down. Maybe just raise your hands above your head, do that a couple of times to raise. So, you know, just being able to move and use your muscles will definitely have a positive effect, you know, in terms of bone health and strength. And similarly with your legs, maybe doing leg raises, again, starting really slowly. That may be something that you can consider in terms of self-care. Regular movement, maybe you like dancing and you haven't really done that in a while. You know, maybe that's something that you can consider starting to do moving forward, something you can do with the family really slowly, but, you know, do it on a regular basis, and over time, you will be able to build up your stamina, and that will definitely help in terms of strengthening the bones, strengthening the muscles to help with your bone health. And so, yeah, so I wanted to highlight that as examples of you being able to take care of yourself. In terms of one activity in relation to your diet, you know, we've gone through all of the different nutrients, fruits and vegetables, vitamins and minerals that come from your fruit and vegetable group. You know, it may be that you're still not able to take enough fruit and vegetables, and maybe from today, you know, in this third session, you can decide to do something and maybe include one fruit and one veg, and start with that and just keep going. And maybe gradually over time, you can work up to your 5 a day to ensure that you could get a good range of nutrients, vitamins and minerals. Because as I've said before, that with vitamins and minerals, they're not made in the body. It needs to be taken in through the diet. So that is something that you can consider as well. Importantly, read your food labels. You may not have been doing that in the past. So this is something that's important. We know that some foods are fortified with iron. And again, if you don't read the label, you won't know that. Or some foods may be fortified with calcium or with vitamin D, but you won't know that if you don't read the labels. And so that is maybe something, a practice that you can adopt that can help you, you know, in terms of just your overall sort of sense of health and well-being, and taking more control in terms of your food choices. So one activity in terms of lifestyle, I already mentioned, you know, in relation to osteoporosis and bone health, but also the cardiovascular risk that we spoke about before, you know, avoiding smoking. If you're not smoking, avoiding smoking. If you are smoking, maybe consider reducing or cutting, stopping smoking. And I know many of the GP services have stop smoking services there that you can tap into. So that may be something that you can consider in terms of a lifestyle change that you know, that can really have a beneficial effect for you. And again, alcohol, you know, depending on how much you take, if you're taking in excess, we know now that that isn't going to have a positive effect on your overall health. So maybe cutting back. You know, 14 units per week is sort of the recommendation. So if you are having more than that, maybe consider sort of, you know, coming back under that 14 units of alcohol per week, but maybe even less, you know. So just think about what you can do in terms of being proactive and improving your lifestyle practices. And when it comes to quality of life, you know, again, it's your health. So deciding to take positive action on a daily basis is really important. And being proactive in that, being proactive in your daily self-care. And there was a comment in the last session in the chat, someone mentioned about having self-compassion. I thought that was really good, and so I included in today's in today's talk as well. So, you know, being kind to yourself. It's you know, living with thalassemia is really hard. You know, it's very taxing emotionally, and so being kind to yourself is something that's really, really important. And so I wanted to add that there, so that, you know, if you're not being kind to yourself at the moment, think about what you can do differently to express that self-compassion towards yourself, but also towards others as well. The last time I said about setting one goal, and it's so important. If you want a different outcome, you've heard this expression, you have to do something differently. So I want to encourage you to decide today to do something different to what you have done before you've heard this talk. And it'll be great to see in the chat the next time, you know, to see what you've decided to do differently as a consequence of having attended this talk, and maybe even what you know, if you've listened to the recordings of the others, what you've decided to do differently in relation to that. Maintaining good relationships is really important. I've said this before, and it's so important, because it will, you know, a shared burden or a shared problem is a problem halved, is what they say. I don't think I've got the saying right, but that the context is, you know, if you can share you know, how you're feeling, you know, it's always helpful in terms of having sort of relationships, helpful relationships around. And then asking for what you need, so important, you know, with your healthcare professionals, your consultant, your nurses, the team that's surrounding you. It's really important to ask for what you need. So the next slide, please. So I've included a couple of patient comments from the last talk, and it was really good to read the comments from the patients. And I just shared 3 of them, and one person wrote one takeaway, because we ended off the last talk with what is one takeaway you take away from the talk, and the person said one takeaway is that I've been eating all the wrong foods. So a benefit of her, you know, being on the talk was that she recognized that she was, you know, choosing wrong foods in relation to the problems that she was experiencing. So that was a really positive thing, and I hope that she did it, and it's continuing to find benefit in changing, you know, the foods that wasn't helping her to stay healthy. Another person said a takeaway is to improve my diet. And another person mentioned it was an excellent session, thank you. So I wanted to share this because for me as the presenter, it's always helpful to get some positive feedback as well, but also to encourage you, you know, don't just listen, you know, take action, because knowledge is without action is inaction. And so it's really important that from what you've learned today, but also if you're listening to the recordings as well, if there's anything that is being suggested that you do differently, that you think about how you can do and how you can implement that. So that will be, you know, just to bear that in mind. So if we go on to the next slide again, so I'll end off today's presentation with what is one takeaway that you take away from today's session. You can include it in the chat. I'll get to read it afterwards. And, you know, it's so important. As I said, knowledge is one thing, but taking action is another thing. So hopefully, you know, you would have taken something away from today, something that you can do differently, or something that you can add, you know, to what you're already doing. And you know, and hopefully you would have, you know, found it helpful and useful attending today's session. That's the last slide of the presentation. So just to say thank you so much for staying. I know we had some problems in the beginning, but I hope you can join us for the next session. We will have a run through before the time to check that all works well. But thank you so much for your attention, and hopefully you would have found benefit from attending today's session as well. Thank you.
Thank you, Claudine, and thank you to everyone as well for being patient with us at the start while we worked through the IT issues. Hopefully, the session